ask people, out of all those systems issues, what do you think are the most important? If you rated them, they all matter, the whole lot. But if you wanted to fix a system, what would you focus on first? Pardon? Poverty. Yeah, except poverty's, you're right, for the equity argument, poverty's are huge. So access to healthcare services in general. And then within that, what would you start with? Where would you start? So I come along and I say to you, what's happening here in 1992? This is fully immunised at the age of 2. How many of our 2-year-olds were fully immunised who were born 2 years before 1992? How many? 55%. Now, I can tell you from an equity point of view, Māori were way lower than that and Pacifica were way lower than that. So we've got an equity barrier already. And even allowing for that, we're saying that nearly half of our kids are unvaccinated. So we've currently got a measles outbreak in several parts of New Zealand. What age group are getting measles? Yeah, it's people who were born this era or earlier. Why? Because look how many weren't vaccinated. So we've got a huge system gap, haven't we, in the country? We've got an enormous system gap. So when I started in this world, this is where we started from. You go, oh my goodness me, we've got a problem. Now you guys have put up all the different aspects of why there were barriers plus equity gaps. What do you think? Where would you start if you wanted to fix the system? Any idea? Out of all of those issues you wrote down. It's hard, isn't it? So what New Zealand started first is we wrote a report. We're really, really good at writing reports. So we wrote a report, and then we wrote a strategy, and then we wrote another report. Classic us, isn't it? I don't want to say too much about our politics, but we're really good at report writing. Now, it helped a little bit, probably because it raised attention to the issue. I work in general practice where I have about 100 issues a day, and you tend to sort of sway to which has the most attention. So one thing about report writing, even if the report's a pile of garbage, at least you're paying attention to the issue. So one of the things is we started paying attention to the issue, and it did improve. So our coverage did improve with all these reports we wrote. There's more reports than that too. And we wrote a strategy, and you can see we were improving coverage reasonably, but we're still way below. What coverage level do you want to be at? Yeah, roughly 95%. That's sort of based on the principle of herd immunity from measles. You want to be as high as you can. So we wrote all these reports, and we were doing better and better, but we were still a long way from the national strategy. Now, why do you think having a register helps? What's the point of just putting a lot of effort into having a register? What difference does it make? Pardon? Exactly. So kids born since 2006, we actually know their immunisation records. So, there's a person in their 40s in intensive care currently in Christchurch with measles. We don't know his immunisation status. He thinks he was immunised when he was a baby, but we don't know. He might have been in that group or he might have been in that group. So you don't know. So firstly, you cannot change systems until you have the tools. Now, it's really, really boring to put a register in place. It's much more interesting to do a mass media campaign. But putting a register in place and being able to find who's unvaccinated is probably the best thing we ever did, along with the fact that we paid it attention. So we gave it attention, we decided it was an issue that mattered to us as a country with all these reports, and then we actually figured out who was missing. And once you can figure out who's missing, you can make a big difference. Now this jump up, a lot of that is probably just measuring. It might not actually be a real increase in coverage at all, we might just be measuring better. And so a lot of this was we could actually figure out who was missing. And there's many advantages in that. The point about at the general practice level, we know who's missing. And then at the higher level, we can then say to the general practice, you are responsible for finding out who's missing. Now that doesn't mean you need to go out and vaccinate them, but you should at least refer them to outreach services when you lose them. So that's the importance of getting all your tools in place. And then of course we've got our tools in place and we're doing better and better, and I love New Zealand. Once we were doing pretty well, we then did our parliamentary inquiry. That's very New Zealand. So all of those things had to go in place systematically. Now, some countries in the world will say, oh my gosh, we've got terrible coverage, let's just go out and do a mass communication campaign and convince everybody they need to be vaccinated. Well, that doesn't work because you don't have the systems in place, you haven't convinced your healthcare professionals, and you haven't convinced your community. So when I started here, people had to actively choose to vaccinate. they had to go out to their doctor, they had to remember their babies were due, and they had to decide they want it. And it was their choice. Whereas now that we've got nearly 95% of our kids immunised, people have to actively choose not to vaccinate. So now it's normalised. You put on a seatbelt when you get in a car. You know, most of us have fluoridated water. It becomes normalised, and then you've got a public health system that works. Okay, so that's my little story around that. Now, equity is the next issue. So it's all very well to get vaccination out there, but we want to get vaccination to those who need it the most. Traditionally, general practice has been very poor on equity. You tend to deliver first to those with the loudest voice and those with the best resources. So equity is a huge issue internationally. Now, what you can see, when you get a better systematic approach, you also close your equity gaps. So you get your system right, you get your baseline system right, you tend to be able to close your equity gaps more effectively. So you can see from this graph how we've done better the wideness between Māori immunisation coverage, which was very low, versus higher up. You can see how we've closed it, and also the gap for kids from poverty. So you've got to get your system right, both for overall coverage but also for equity. All right, so what is my first question to everybody? What made the most difference? Well, firstly, paying attention to an issue. Secondly, getting political will at all levels and healthcare service will, so that all of us now in the healthcare profession believe this is an important issue. And then after that, having the systems in place to actually be able to deliver your job. And then after that, interestingly, community demand comes alongside it. So mass communication campaigns, they only work if they're within the context of a functioning system. If you don't have a functioning system, you're just wasting money. So New Zealand's actually put pretty small amounts of money into communicating and health promotion and much more into effective systems. So you need all of those elements, but you've got to get your systems right. So that's my little message on that. Now, we thought we were doing pretty well, but what does this graph show us? So what's this showing? This is fully immunised at 2 years of age. You can see that we did well. What's it showing now? Yeah, so I don't know if you guys have heard, but since about mid-2017, we are seeing a drop-off in immunisation coverage by a few percentage at the age of 2. All right, now there's another graph. If I look at immunisation coverage at the age of 6 months, what is that showing? A drop-off and a bigger drop-off. And interestingly, if you look at this drop-off, it's actually from late 2015, so it's earlier. So if I'm measuring coverage at 6 months of age, what do you think that's measuring? What is the childhood schedule? What ages do you give it? Your baby schedule, when do you give them? You give maternity vaccinations, okay? And then what's the first age you vaccinate? Second one? 6 weeks first, 3 months, third one? Third one is 5 months. So if I'm measuring coverage at 6 months, I'm measuring those 3, aren't I? But I'm also measuring getting them in on time. So this is a measure of getting vaccines in on time. Who has trouble getting their vaccines on time? Who do you think would find it hard? Yeah. Babies aren't renowned for being on time. Yeah, keep going. Yeah. 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 That's right. Keep going. So what sort of population groups would find it hard to get their 5-month vaccine in for their babies on time? Rural people? Oh. Yep. So access issues are huge, aren't they? So access issues, rurality would be one of them, but all those barriers to getting in on time. What about the priorities in your life? You know, 'cause I always get to my hairdresser on time, but I'm always late for my smear. Now, why is that? It's because cervical cancer isn't in the front of my mind, whereas, my God, my hair always is, because it's a problem, yeah? So priorities really matter. So getting your vaccines at 6 months, if it's not a driving issue, is a bigger problem. So we're really focused on getting vaccines in on time. So which groups could you predict would have more trouble getting the vaccines on time? You can predict this, can't you? It's obviously there are major drivers. Now, we often just talk about ethnicity, but there's reasons underneath behind different ethnic groups and different socioeconomic factors why it drops off. Now, if you look at this graph, you can see that the drop-off is particularly in which ethnic groups? Can you see? Sorry? Well, Pacifica is the green, so it's actually doing pretty well, isn't it? Other, yeah. Does anyone know what other means in our stats? Exactly, everybody else. So you're right, it's refugees and migrants. Now this other group, some of them might be just transcribing if they've come from overseas, but essentially there's often a lot of people out in our community who might be coming from different schedules, might be shifting in, and they're obviously dropping off. They might be refugee migrant groups, and the Māori group is dropping off very dramatically. So we have to look much harder at what factors are happening there as to why some kids we're struggling to get immunisation into them over other kids. Now, you look at that at 2 years, and then you look at it at 6 months, okay, and you see the same pattern, okay? So we've got a real problem. Now, I think one interesting point for Pacifica kids is that at 2 years they do really well, but at 6 months they struggle. So why do you think Pacific people are good at getting their kids fully vaccinated? Because actually they get really high rates. They're nearly 95%. See that green line? They're nearly 95% at 2 years. And you look at Pacifica kids at 6 months of age, and they're way behind New Zealand, European and Asian. So why do you think Pacifica kids are not getting vaccinated on time, but are getting vaccinated? Pardon?
I said island time.
Island time, yeah, there's some truth in that. Well, the thing is that there's a big international conversation going around vaccine hesitancy. These kids are getting vaccinated, so it's not necessarily around hesitancy, it'll be other access barriers, okay? There'll be a whole lot of access barriers as to why these kids are not getting vaccinated. So there's a big argument internationally going on in Europe at the moment saying it's all about vaccine hesitancy, people don't want vaccines. What this graph shows is they do want vaccines, they're just not getting them on time. So that is a systems problem, okay? That's about us and our system working effectively. So how could you get a kid effectively vaccinated on time? What are the systems issues that would really help? And you've got them all on the blackboard. So you want to get your Pacifica community vaccinated on time. You want the 16-year-old to bring her baby in on time. What could you do practically that would help? Send reminders, yeah. So my hairdresser always texts me to remind religiously, you know, very useful, isn't it? Years ago in general practice, we didn't do that. And now we do text to remind. What about the language barriers, you know? It's no good text to remind if they don't know what you're talking about and how it's written and the engaging style it's written. Yeah. Yeah. We do. So what we do is you do everything appropriate at the general practice level to engage, and if you've failed to engage, you rapidly refer to outreach services. One of the big reasons for the increase in immunisation coverage and the reduction in equity gaps is because we have outreach services closely associated with the general practice. So any other things that would really help people to get in on time? You guys have come up with other barriers before. How would you fix them? You've got the money now from the government, you know. The government's done its parliamentary inquiry. It's going to give you a couple of billion to fix this problem. All right, we're going to make sure our general practice reminders are working. We're going to make them engaging, communicative. We're going to have friendly practices. We're going to have outreach services. What else can you do? Early childcare, yes, there's a whole lot of things that you can raise demand for. So early childcare services now, when people go to early childcare, they need to present their immunisation certificate. So that raises demand. It doesn't make it on time, of course, which is one of the problems. What else? Why are people not getting into the general practice? How could you fix that?
Could you implement shuttles?
Implement?
Shuttles.
Shuttles?
Yeah.
Transport, yeah. Petrol vouchers, transport. There are navigators out there now. Whānau Ora helps people bridge them into the service. So that's right, bridging people to make it easier to access the service. So you've got the community side. How do we make it easier for the community? What could you change in the system? Is there anything you could change in the system that vaccinates to make it easier to people? You know, when your general practice is only open 9 till 5, Monday to Friday, and you work as a full-time cleaner and you've got 3 kids, you are not going to get in on time. I saw 2 people last week with kids who were late for vaccination because they could not get time off work. So how can you fix that? Yeah, so you can increase your hours of clinics. You know, with flu vaccine now, we're offering pharmacy vaccination. There are ways of offering the services that are more accessible to people. So there's a whole lot of different ways of doing it. And I guess the other thing is to raise the stakes a bit. My point that I will go to the hairdresser because I'm obsessed with my hair, but I'm not obsessed with cervical cancer. How can we raise the stakes a bit? If we were doing some public communication around this, how would you? Yeah, you could do some media campaigns. And what would you pitch them? What would you be talking about?
I'm just kind of like imagining like all the cervical smear tests, like ads and stuff.
Yeah.
Those kind of things.
Yeah.
And then like, yeah, so like similar to like.
Yeah, keep going. You're right. Yeah.
Measles or like whooping cough and like
Yeah.
show like a baby.
Yeah.
And it looks, because I'm from the video, that was.
So that worked for you, didn't it? So, you know, we're always accused, we have to be careful not to do scare tactics, but the evidence base would show that so long as with the scare tactic, you've got a point of action. So you can actually show whooping cough and talk about the whooping cough epidemic and then go, if you're vaccinated in pregnancy, if your child is vaccinated, then you're very unlikely to have this problem. So absolutely, you know, we can associate it with an action point. So then our communication and our broader public health work alongside the systems. So absolutely, those are the ways we go. And then you also can pull in the champions and the national support. So it's really important that you have a government that supports vaccines. So there are countries around the world where the governments are really quite negative. And you can imagine what that does to community confidence. So to put it all together into an interactive picture requires all those different things. And that's the deprivation factor that shows you that the challenge is always for the kids from poverty. And that's about to the point of raising priority for public health issues. Because, you know, if any of you have lived in environments of significant deprivation, you know the chaos of your environment and how hard it is to overcome. So immunisation issues are fighting with all the other desperate issues in those environments. So that's why we need to make services easy for people. I think that's it, really. And just to show you guys, we also need to look at what's happening later on. So kids are immunised at 6 weeks, 3 months, 5 months. When's their next vaccination after that?
12 months.
Close.
15.
15 months, that's right. You can have it from 12 months, but 15 months. And the next event after that? 4 years. So this is the 4-year-old event. So you can see the same trend that we're doing better to the age of 5, but we've still got a way to go.
From a personal point of view, the 4-year one is actually the worst one. The kids are so young for all the other ones. They scream briefly and then that's it. But by the time they're 4, they are
You got good memories.
aware of what is going on and really not happy about it. So that doesn't surprise me that that's where...
That's a hard one, yeah. I mean, the other thing that we forget all the time is part of vaccine hesitancy is just fear of needles. And these kids, some of them have got quite significant needle fear by then. So we have to have a good experience. So we spend a lot of time training our frontline healthcare professionals to make your vaccination experience okay. The point over there about number of visits is that they have to come back. And if your first vaccine experience is dreadful, you won't come back. So integrated into the system is making sure our frontline healthcare providers are well educated, confident and do a good job. And it's not just the communication, it's also the vaccine experience. And for example, one thing we've shifted towards in the last couple of years is the 6-week event now. You fully breastfeed all the way through the event because breastfeeding, because of the sucrose load in the breast milk, reduces the ouch factor. And the baby gets through the event without even crying if they breastfeed all the way through. So the mother's coming away feeling like it's been a really good event. You can positively reinforce that you've done really well. You're much more likely to come back for the next one. And then maybe we'll get them at 4 years then. So I think that's the end of that bit.